there?
Before delving into the world of being a doctor,
Let's take a step back.
remember going to the clinic as a kid?
Remember all the questions the doctor has asked you?
Well, let's switch roles for a while.
How many hours of sleep do you get, Doc? How many days do you eat 3 healthy meals? How many mornings do you jog? How much water do you drink a day? When was the last time you had a health checkup?
How much of what you preach do you actually follow? Everybody has gone to a hospital at some point in life, and it's usually the doctor treating us, prescribing some medicines, and voila, we're back to being blissfully healthy again. But how many of us have thought about the doctor's health? How many doctors follow their own advice? We need to take into account both physical and mental health issues experienced by doctors. Let's look at the evidence put in front of us. It has been proven that doctors are more prone to cardiovascular conditions such as myocardial infarction than the general public. This is due to the greater work pressure in their profession.
As we take a look at the mental health aspect, we find out that medical professionals have a higher risk of dying from suicide than the general population. This is the end stage of a treatable disease.
This makes us wonder, are doctors given the help that they are in dire need of? Do we ignore their perspective due to the paradoxical irony of their situation?
The job of a doctor is considered as a noble profession. But how badly are doctors hurting themselves in order to help others? Let's venture a little into this perspective, into the daily life of a doctor.
The most basic of life needs a decent amount of sleep and healthy food. How many doctors actually get to afford these luxuries? How many hours of sleep do you get on an average per night?
Roughly about 6.5 hours in a day.
6.
See to that minimum 6 hours I sleep.
5 to 6 hours.
Around 6 to 7 hours. Get 5 to 6 hours.
How many balanced meals do you have per day?
Difficult question to answer because on an average, I don't even know whether I have a balanced meal. Most of the time, I eat once, maximum twice in a day.
2? I think 1.
Perhaps I'm taking 2.
I don't know about balanced, but I try to have 2 meals.
Now let's think about how much time doctors can give themselves. No matter how tired a doctor gets or how upset a doctor gets, he or she can't take a spontaneous trip to Bali. Medicine isn't a 9-to-5 job, and the sick can't wait for the doctor to be physically or mentally ready to work again.
Do you get the personal time that you'd like daily?
No.
Sincerely speaking, no, not much.
I would like a lot more personal time than what I do get at present.
Very difficult to get the adequate personal time.
Actually, this is really a very tough question because first thing, I'm a professional. Second thing is I'm a female doctor where I need to concentrate not only on my profession, where I'm really want to prove myself to some extent. And the second thing is me being a mother. So concentrating on the family plus my profession will hardly give me a time for that is me time for myself. So it will be really very difficult at this juncture to say that I have time for myself.
When was the last time you had an extended break for yourself?
Almost 4 months back.
Maybe last month.
6 months ago? Fortunately, it was this year. But in the earlier part of this year, I managed to take a fairly long vacation. But that said, that vacation was after a period of 20 years.
Making sure the doctors don't reach a breaking point due to mental exhaustion is something that we have to seriously consider. In fact, some doctors in their everyday lives face difficult situations, whether it's revealing a chronic illness to a patient or having to pacify a deceased one's family.
Thus, depression is an occupational hazard in the medical field. Doctors especially have a hard time taking help from other doctors as it may be revealed to their colleagues. Hence, they themselves fall into the self-destructive phase. In fact, suicide is the second largest reason of death in the medical field, especially in resident doctors.
What is your opinion on this? How do you think this situation can be improved?
This is something you learn to cope with over a period of time. All of us, when we started in the profession, we would get depressed not only because of the work-related things. It was you didn't want to lose a patient. You lose a patient, you always ask yourself whether you were the cause of it, whether you could have done something. And then you face the anguish of the relatives all that tells, over a period of time, we tend to kind of wear it down, because as long as you are depressed and you are not capable of handling your own emotions, you will not be able to help other people handle their emotions. So as you progress in the field, depression is something that takes a back step. If you really want to help patients, then you need to keep your own emotions under check. It happens to us, even at this point in time, when I'm dealing with a sick child, I tend to get emotionally attached. But the problem is, if you get emotionally attached, then you are no longer clinical, you are no longer scientific. You may take an irrational decision. So coping with depression, coping with emotions is something that we all have to do. And it's no point in saying that I need help to take care of my depression, because ultimately that will become a crutch. What we need to do as we grow in this profession is to learn to help yourself.
That's true. The main issue that we have not been able to accept is doctors are also human beings, and just like anybody else, human beings, they can also go through pretty bad phases in their life, and depression is so common. Unfortunately, people in medical profession feel ashamed to talk about it. They think that if you have depression, it means weakness, and they will reflect upon how the patients will think about them if they themselves are taking help. And what we need to understand is that what happens to cardiology? Do all people who take cardiological sciences will be immune from cardiac problem? The answer is no. So we need to create awareness among the students who join the profession, and maybe we might have to help them to understand it's okay to talk about depression, start taking help, and if you feel suicidal, it might be a time to seriously take professional help for those issues.
More often than not, doctors end up bringing their work stress into their homes, into their families. This emphasizes the importance of maintaining a healthy work-life balance.
How often do you return to your home with a case running circles in your mind?
Almost every time.
Every day, several cases.
Every day. But it's impossible to divorce yourself from your work in this profession. Even when you go home, there are times when you sit together for a minute and say, maybe I should have thought of this, or maybe I should look at that, or maybe there's something that I'm missing. So especially when you have a difficult case, it keeps running in your head 24/7. It's not very uncommon for us to even dream about it probably. But the thing is there that you can prevent it from interfering with your home life if you are able to kind of segregate it and say, okay, I will think about this again when I have a little time.
Right. Quite often. Sometimes it really, we need to rethink of those cases we saw a couple of hours ago, that we might have to think what we have to do next day. I think at least 30% of our time, even at home, is consumed by these thoughts, what we should do, what we should have done, what needs to be done, how to tackle it. So I think it takes a good chunk of our free time.
What do you think can help in maintaining this fragile balance?
That we need to learn in our profession a very, very efficient time management. Otherwise, you will be burning out yourself, and you will not be able to give adequate quality time to yourself as well as your family.
Work-life balance is something which is more spoken about than practiced. The major reason is the multitasking. We keep on involving ourselves in most of the activities, and at the end of the day, we end up in giving less justification or justice to all the activities we do, and that keeps tremendous stress on it, and stress that we take to home, and we keep creating problem to the people in the home. The basic way in which we can prevent this, we can balance the work and life, is prioritizing our activities, what we need to do when, and what time has to be given to what type of activities, and how I am going to do it, giving my full quality time. That we need to decide first, and then we need to proceed further.
Apart from mental health, many doctors often neglect their own physical health. Annual health checkups, no matter how cumbersome may they be, are a must for every person.
However, many physicians ignore their own health and neglect these checkups. All of us require good maintenance of health, and doctors are no exception to that.
How many months ago was your last health checkup done?
I have not had a formal health checkup so far in my life.
I think seriously, last month I underwent health checkup, and before that I had never been.
Do you have it done as regularly as you should?
No.
Maybe my last checkup was done about 6 months back, and I do agree with you. Doctors are very, very bad patients. And many of the time I have evidences of my own colleagues not recognizing or realizing the need of self-care, and not only they become careless for their health, maybe because of want of time, and number two, knowingly they don't get it assessed or checked. So this is one profession which is doing a lot good to the patient, but they don't take care of themselves.
The physical health of many doctors is adversely affected by their own occupation. Between having no time for their own physical activities, such as exercise and yoga, and having long, strenuous work hours, they are much more vulnerable to cardiovascular diseases. Depression alone is a major cause for myocardial infarction in physicians.
What are your thoughts on deteriorating physical health in doctors and higher mortality at younger ages?
Yeah, I do agree with you. Because of the want of time, though we do preach a lot to the patient for preventive aspects, improvement in quality of life, especially physical activity, preservation. In majority of the doctors, it is a big problem. Either they get drained out by their work, and so they don't have intention to keep doing physical activity, or they are stressed by the professional work, so that they don't get that agility to maintain physical activity. 90% of the doctors, I can say that they don't practice what we preach. So I am not an exception for that.
That's very true that doctors in general have shorter lifespan because they tend to think that it's okay to compromise on one health and do everything for people's health, and that takes a big toll on their health. And as such, the profession involves long sitting hours, long standing hours, and very less time for physical activity. We don't get enough time to think about daily physical fitness and such routines which are so common for other people. It's important that we realize and we start working for ourselves.
Let's take a look at a few numbers and understand the gravity of this situation. According to a study done in June 2019, the doctor-patient ratio in this country is incredibly low. There is only one government allopathic doctor for every 11,000 people, and only one state-run hospital for a population of 55,000.
Due to these staggering numbers, the work pressure is incredibly high. Doctors, including newly joining residents, face extremely long and strenuous work hours, going up to 15 hours of duty per day. How has the workload changed over the years for a resident doctor?
There is a lot of shift. When I was doing my undergraduation and I joined my post-graduation, the work pressure was more because the number of postgraduate students and the residents in each of the departments were very limited, and the number of work hours used to be quite more. But now, after the increase in the postgraduate seats in the medical colleges, and also the paramedical force is also doing a lot of activities, the amount of workload on the medical residents has come down. But more than that, the kind of stress the medical students take and the vulnerability towards the mental illnesses has increased, and whatever the reduction in the working hours, but on the other hand there is an increase in the stress levels that has again ended up in creating the same kind of a situation. one point is the work pressure or burden is the mental phenomena, it's more subjective, and there will be few people who will be working 18 hours continuously without perceiving much of the stress, and there are people who work for 6 hours and perceive same amount of stress as a 18 hours a person is working. So it is again a subjective phenomena, but we need to really give a major amount of thought for it.
Now let's discuss about the current societal issues faced by doctors these days. There have been many accusations put forward against doctors in the last decade. What are your thoughts on the recent increase in medical legal cases and the ethics involved behind it?
More of a global concern, and because there are not many things happening here. Since I belong to forensic medicine, deals with more of medical legal issues. Major contribution is because of half knowledge on medicine and medical profession amongst our patients by this media and other print and electronic media, and non-medicos getting googling and getting to know a lot of things which they interpret in their own different possible ways. Only way out of this is to train our medical students in communication skills. Our students are very good in their subject, but maybe they are not able to communicate it to their patients or caregivers of the patient. Even cases have reported that the negligence suits are made not because of the deficiency of the doctor, but because of the deficiency in communication. So perhaps we need to train our students in communication.
Universities across the country has been on the raise, and the only way to come out of this is every one of our colleagues should follow the professional ethics, should never talk anything bad about another colleague. Number 3, very adequate, important component is keep your cool even in emergency. Never aggressively talk to the attendants of the patient, and counsel them properly, communicate, learn the art of communicating and telling properly. This is one of the very important area. Your advanced knowledge may not matter too much, but a skill of communicating and a skill of keeping your cool and talking to them properly is very important.
There are many physiological and biochemical changes that occur in our body due to external factors like stress, anxiety, and exhaustion. Now let's delve in that aspect. What is the role of physical activities in mental health?
Physical activity promotes mental health. This is what one would say very broadly. And there are many reasons for this. There is a lot of evidence for it. And certainly it is one of the best recommendations that we can offer anybody, that promotes mental health, protects mental health, and it even improves mental health. Physical activity does not simply mean that you are walking around all the time at your place of work. Physical activity obviously refers to an additional activity that a person has beyond the physical requirements of work itself. This often takes the form of jogging, walking, swimming, and other such what we call as exercises. This is advisable. It is something that is shown to have enormous benefit, not only for mental health. Of course, straight up it improves physical health, but physical health, and now there's a recognition that it improves mental health. But one has to understand that it plays a large role in improving the person's family and social health also.
What biochemical changes occur in our body due to stress and anxiety?
Stress and anxiety cause a lot of changes within the body. Some of them I will mention. Some of them, like the response that an emergency physician has to stress, is something that is well studied, and it is an important aspect of regulating how an emergency physician works. Release of adrenaline, for example. Release of adrenaline in response to the stress is an important part of how an emergency physician reacts. At certain levels, adrenaline is beneficial. It causes an improvement in the person's functioning. However, at higher levels, it causes a reduction in the ability of a person to perform. It reduces their ability to do fine work, it reduces their ability to take decisions, it reduces their ability to perceive a situation as a whole.
Becoming a doctor is no easy task, but it is even harder to stay true to your profession and persevere your practice. We have one closing question for you.
What does it take to be a doctor?
It's a noble profession.
It's passion.
You need to be passionate about your profession. You need to have plenty of knowledge. You need to have patience. You need to have skills. And you need to have a positive attitude.
It takes courage, it takes love of your fellow human being, and it takes dedication, it takes discipline, and it takes hard work in the field of science.
Being humble is all it takes. Stay humble.
The only thing it really takes is a love for the profession. It's very important that you should enjoy what you're doing. I personally feel that if you have job satisfaction, if you love what you're doing, there is nothing that can give you greater pleasure, at least as a pediatrician. For me, nothing gives me greater pleasure than to see a sick child walking home or a sick child smiling and playing in the world. The feeling that you want to become a doctor and the feeling that you want to stay a doctor. That's about it.
Having been selected for this profession, let me enjoy that. Let me use all my time and energy to prove that doctors can be great, doctors can be useful. So I convey the message to the future medical students and doctors. You are one of the luckiest persons in the field. You are lucky to get a seat in a medical college. Enjoy that, be happy about it, make the whole world happy. In Sanskrit we always say, Sarve Jano Sukhino Bhavantu. When everybody is happy, they bless you, you can also be happy. Right? So take this as a great profession, enjoy working for that, people always respect you.
The takeaway message that we're trying to convey is that doctors are human too. Working like machines is beyond them, just as it may be for an engineer or a professor. Our society needs to come to terms with that. Being a doctor is tough, but there's no other work as rewarding as this profession. As long as a balance is maintained between life in the clinic and life outside it, doctors can stay happy and satisfied in life too. So, take care of others, but take care of yourselves first.
Eyes full of dreams, too tired to close, amidst the scalpels and the right doors. There lives a soul as human being, hiding those scars that no one ever cared to see. Each day starts with a hope and ends with no sleep. They cannot step back, but there are promises to keep. They find their joy in the smiles of the ones they save. They may be breaking down, but they'll still ask you to be brave. So here is to you, your faith and your work, because no one can take your place on this earth. Here is a plea to choose yourself once in a while, to hold your own hand as you walk another long mile. Because your existence is a blessing and it's true. Sometimes the healer needs healing too.